It is one of the most common diseases diagnosed in women. In fact, endometriosis may affect more than 11% of American women between the ages of 15 and 44. March is Endometriosis Awareness Month, which gives more women an opportunity to understand more about this condition. And to provide some insight, we are live with Dr. Patrick Clayton, who is an OBGYN with St. Francis Medical Partners. Good morning, and thank you for joining us. What is endometriosis?
Endometriosis is when the lining of the uterus, called the endometrium, is found outside of the uterus and the pelvis. It could be on the uterus, the fallopian tubes, the pelvic sidewalls, and even the bowel.
Okay, and so what are we looking for as far as symptoms are concerned? Because I understand some people don't know they have it.
So the main symptoms are either chronic pelvic pain that can come with cycles, and also the other main issue is some people experience infertility issues due to the endometriosis.
Okay, now I know I mentioned the age group, an 11%, but when you look at the wide range of ages and who this really affects, is there kind of a hot spot?
The hot spot would be women of childbearing age, so people from their early teens through their late 40s into early 50s. You see some outside of that, but that's by far the majority of patients.
And so, I mean, is this something that's genetic, or it's something that, you know, outside factors or lifestyle or it's caused by?
Not exactly clear, but it's thought to be from outside factors, like just when you have a cycle, the blood actually kind of goes back into the pelvis and can implant that way is one leading mechanism of thought. But it's not very well understood how it exactly happens or why it happens to some people.
And when you look at just the patients you treat, I mean, is there a large number there for you?
Certainly, yes. It's a significant issue for a lot of women.
Wow, okay. Now let's talk about what to do to get it diagnosed, and then we'll move forward. If there is a diagnosis, what we should do to treat it.
So to start with the diagnosis, you get a complete history from the patient talking about when they have their pain, when their pain comes, and if it fits some of the symptoms. And then to truly diagnose it, you would have to do a surgery to be able to view it within the pelvis. However, before we step to surgery, we can often start with some treatment, and if the treatment seems to be working, then we can kind of work with a presumptive diagnosis of endometriosis and see what we can do to improve the quality of life from there.
Okay, and what kind of surgery are we talking about? Is this something where it's just kind of an outpatient thing, or?
Typically, yes, and you would go in and either remove the endometrial implants or remove any of the scar tissue that was caused by the endometrial implants, and usually it is an outpatient surgery.
Okay, anything I didn't ask that you just, you know, you want people to know about endometriosis?
It can be a very treatable condition, but untreated, it can lead to some loss of quality of life. So I recommend, if you're having issues with chronic pain, address it with your doctor and see what options you can come up with for treatment.
Okay, Dr. Patrick Clayton, we are putting the information for St. Francis Medical Partners on the screen there. It's 901-585-0396. We'd like to thank you for taking time out today to bring awareness to endometriosis.
Thank you for having me.